Death does not come from the heart, as many think, but from the legs. These words may seem strange to you, but in 40 years of medical practice, I have seen thousands of patients whose hypertension began precisely with problems in the lower limbs. If you notice that your blood pressure is rising more often, if the pills are helping less and less, if your legs feel heavy and swollen in the morning, then the cause of your hypertension is not in your head and not in your heart. It is in your legs, and today I will explain this to you in detail, calmly and without haste. You wake up in the morning and feel heaviness in your legs. You get out of bed and your head spins a little. You go to the bathroom, measure your blood pressure, and see numbers like 160, over 100, or even higher. You take the pill that the doctor prescribed, but after a few hours, your blood pressure starts to creep up again. By evening, your ankles swell, your shoes become tight, and your legs feel like cotton. You feel a pulsing in your temples, ringing in your ears, and you fear that a stroke may occur. This is not just a set of symptoms. It is the body's signal that the venous system of the legs has stopped functioning properly and blood is not returning to the heart as it should. My name is Aristark Ignatievich Vavilov, and I have worked as a therapist in a city clinic for over 40 years. During these years, I have studied hundreds of medical research studies on the connection between venous insufficiency of the lower limbs and arterial hypertension. I have observed how patients take expensive pressure medications for years, but no one tells them that the root of the problem lies in their legs. Today, I will share with you the knowledge that has helped many of my patients lower their blood pressure naturally without increasing their medication dosage, using 3 simple exercises that can be done at home. Today, you will learn 3 methods that will restore venous outflow from the legs and normalize arterial pressure. You will understand why blood stagnation in the lower limbs makes your heart work under overload. You will receive an accurate exercise execution scheme indicating the time, number of repetitions, and proper breathing technique. You will learn to determine when your vessels begin to recover and what signs of improvement will appear within just 3 days of regular training. But before we move on to the exercises, it is important to understand how exactly the legs affect blood pressure. The human body contains about 5 liters of blood, and nearly 2 liters of this blood are at any given moment in the veins of the legs. The veins of the lower extremities perform a very difficult job. They must lift blood against the force of gravity up to the heart. For this, nature has created venous valves, special flaps inside the veins that allow blood to flow in only one direction and prevent it from flowing back down. These valves work together with the leg muscles, which, when contracted, squeeze the veins and push the blood upwards. This mechanism is called the muscle venous pump, and it is the second heart of a person. After 50 years, the venous valves begin to weaken. The valve leaflets stretch, lose elasticity, and fail to close tightly. Blood starts to seep back down, accumulating in the veins of the legs, stretching their walls. The pressure in the veins of the lower extremities increases. At the same time, the leg muscles in most people over 50 weaken due to a sedentary lifestyle. The muscle pump works less effectively, and venous return of blood to the heart slows down. Venous stasis occurs, or medically, chronic venous insufficiency. This means that the veins cannot effectively return blood to the heart. Now imagine what happens next. The heart pumps blood into the arteries, the blood reaches the legs through the arterial system, but it returns slowly and incompletely through the venous system. An excess volume of blood accumulates in the legs. The total volume of circulating blood in the upper body and heart relatively decreases. The body perceives this as insufficient blood supply to vital organs. In response, compensatory mechanisms are activated. The adrenal glands release the hormones adrenaline and noradrenaline, which constrict the arteries and raise blood pressure. The kidneys retain sodium and water, increasing blood volume. The heart begins to beat harder and more frequently, trying to push blood through the narrowed vessels. All of this leads to a persistent increase in blood pressure, that is, hypertension. If you do not address the problem of venous congestion in the legs, the situation gradually but inevitably worsens. At first, you notice a slight heaviness in your legs by the end of the day. Then swelling appears, initially small and barely noticeable, then increasingly pronounced. Shoes become tight by evening, and socks leave deep marks on the ankles. Then, vascular star formations appear on the skin of the shins, small dilated veins of a bluish color. The veins become visible under the skin. They are twisted, swollen, and painful to the touch. The skin on the shins darkens, becomes dry and sensitive. With the slightest bump or scratch, bruises appear that take a long time to heal. In the most severe cases, trophic ulcers develop, non-healing wounds on the skin of the shins that require prolonged treatment. But the most dangerous consequence of venous stasis is the formation of blood clots. When blood stagnates in the veins, it thickens, and its flow decreases. In areas of damage to the venous wall or in zones of particularly slow blood flow, clots or thrombi begin to form. These thrombi can suddenly detach from the venous wall, enter the pulmonary artery with the blood flow, and cause pulmonary embolism. This condition can lead to death within minutes due to respiratory and cardiac arrest. That is why I say that death comes from the legs. Most people make the same critical mistake in treating hypertension. They take pressure medications prescribed by a doctor, but they do not work on the cause of high blood pressure. The pills do lower blood pressure, but they do so artificially by blocking the very compensatory mechanisms that the body has activated in response to venous stasis. The medications cause the blood vessels to dilate, the heart to beat slower, and the kidneys to excrete more fluid, but they do not eliminate the blood stagnation in the legs. Therefore, the dosage of the medications has to be constantly increased, new drugs added, and still, blood pressure is poorly controlled. Meanwhile, venous insufficiency progresses. Another common mistake is using compression garments without strengthening the muscle pump. Compression stockings or socks do indeed help the veins. They compress the legs from the outside and facilitate the upward movement of blood. However, if the leg muscles are weak, if the muscle pump is not working actively, compression garments provide only temporary relief. Moreover, constant wearing of compression without muscle training can lead to further weakening of the muscles because all the work is done by external compression. Compression garments are necessary, but they should complement active muscle work, not replace it. The third mistake is the belief that simply walking more is enough to solve the problem. Walking is beneficial for the cardiovascular system. That is true, but regular walking engages the leg muscles uniformly and does not create the intense contraction of the calf muscles that is necessary for effectively pushing blood out of the deep veins of the lower leg. Special exercises are needed to restore venous outflow, which specifically activate the muscle venous pump. These are the exercises I will show you now. Now let's discuss the 5 main reasons why the venous system of the legs weakens and leads to increased pressure after the age of 50. The first reason is the age-related decrease in the tone of the venous walls. Over the years, the connective tissue that makes up the walls of veins loses collagen and elastin. Veins become less elastic, making them easier to stretch under blood pressure. The valves inside the veins are also made of connective tissue, and they stretch along with the walls of the veins. The flaps of the valves stop closing tightly, and blood begins to flow backward. This process is natural for an aging body, but it can be significantly slowed down. The second reason is the decrease in muscle mass and strength in the legs. After the age of 50, if a person does not engage in specific exercises, they lose about 1% of muscle mass annually. This condition is called sarcopenia. The leg muscles become weaker, they contract less effectively, and the muscle venous pump does not work efficiently enough. Blood stagnates in the veins simply because the muscles cannot push it upward with sufficient force. Strengthening the muscles of the calves and thighs directly improves venous blood return. The third reason is a sedentary lifestyle. Most retirees spend a lot of time sitting or lying down. When you sit, especially if your legs are bent at the knees, the veins behind the knee get compressed. Blood accumulates in the veins of the lower leg and foot. When you stand still for a long time, the situation is also bad because the muscles do not contract and the pump does not work. Blood, under the influence of gravity, flows down and stagnates. The optimal routine is to alternate body positions and move your legs regularly every 30 to 40 minutes. The fourth reason is excess weight. Every extra kilogram of weight creates additional stress on the veins of the legs. Fat tissue, especially in the abdominal area, compresses the large veins in the abdominal cavity, hindering blood flow from the legs. Additionally, fat tissue releases substances that damage the walls of blood vessels and promote inflammation. Losing weight even by 5 to 7 kilograms significantly eases the workload on the venous system and lowers blood pressure. The fifth reason that few people know about is chronic dehydration. Many elderly individuals do not drink enough water because they fear swelling or frequent trips to the bathroom. However, when the body lacks water, the blood becomes thick and viscous. Thick blood flows more slowly, is more prone to stagnation in the veins, and the risk of blood clots increases sharply. One should drink at least 1.5 liters of pure water a day in small portions throughout the day. It should be water, not tea, coffee, or soup. Water thins the blood, improves its flow, and venous drainage becomes easier. I remember one patient, Maria Petrovna, who was 64 years old. She came to me complaining of constantly high blood pressure, 170/110, despite taking 3 different medications. She had severe leg swelling by the evening, heaviness and pain in her calves, and frequent headaches. When I examined her legs, I saw enlarged veins, dark skin on her shins, and deep marks from her sock elastic. I explained to her the connection between her sick veins and high blood pressure. Maria Petrovna started doing the exercises I showed her, twice a day for 15 minutes. After 2 weeks, the swelling decreased by half. After a month, her blood pressure stabilized at 140/90 without increasing the dosage of medications. After 3 months, we were able to reduce the dosage of one of the medications. She told me that for the first time in many years, she feels lightness in her legs and her head no longer hurts every day. Now the most important thing, 3 exercises that will save your vessels and lower your blood pressure. The first exercise is called the venous pump of the foot. This exercise activates the venous plexus on the sole of the foot, which works as an additional pump while walking. You can do this exercise sitting on a chair or lying in bed. Sit comfortably with your back straight and both feet on the floor. Now slowly lift your heels, keeping your toes pressed to the floor. Raise your heels as high as possible, feeling the tension in your calf muscles. Hold this position for 3 seconds, breathing calmly. Then slowly lower your heels to the floor. Now, in contrast, lift your toes up while keeping your heels on the floor. Pull your toes towards you, feeling the stretch in your calves and the front of your shins. Hold for 3 seconds, then lower your toes to the floor. This is one cycle. Perform this exercise 20 times in a row, in the morning after waking up and in the evening before going to sleep. When you raise your heels, the calf muscles contract and push blood from the deep veins of the shins up towards the heart. When you lower your heels and lift your toes, the muscles relax, the veins expand, and fill with a new portion of blood from the feet. Then the cycle repeats. This rhythmic contraction and relaxation of the muscles creates a powerful pumping effect. With 20 repetitions, you pump a significant volume of blood through the veins of your legs, relieving them from stagnation. It is very important to perform this exercise slowly, without sudden movements. Each heel lift should take 2 to 3 seconds, hold for 3 seconds, and lower for 2 to 3 seconds. Do not rush. If you do it quickly, the muscles will not have enough time to fully contract, and the effect will be weaker. Breathe evenly. Do not hold your breath. Inhale while lifting your heels. Exhale while lowering them. This breathing additionally helps venous return because inhaling creates negative pressure in the chest cavity, which draws blood from the veins to the heart. If you have weak legs and find it difficult to lift your heels high, start at a level that is accessible to you. Even a small heel lift is already effective. Gradually, as your muscles strengthen, you will be able to lift your heels higher. If you cannot sit on a chair due to knee or back pain, perform the exercise lying in bed. Lie on your back, bend your knees, and keep your feet on the bed. Perform the same movements, lifting and lowering your heels and toes. The effect will be slightly weaker than in a seated position, but still significant. The second exercise is called the calf raise. It specifically strengthens the strongest muscle in the lower leg, which is responsible for venous return. Stand up straight, feet shoulder width apart, holding onto the back of a chair or a wall for balance. Slowly rise onto your toes, lifting your heels off the ground as high as possible. Imagine that you are trying to reach the ceiling with the top of your head. At the top position, hold for 5 seconds, feeling maximum tension in your calf muscles. Breathe calmly. Do not hold your breath. Then slowly lower your heels back to the floor, but do not fully relax. Immediately begin the next raise. Perform 15 of these raises. This exercise creates a very powerful contraction of the calf muscles, which literally squeezes blood from the deep veins of the lower leg. When done correctly, you should feel a slight burning sensation in your calves by the last repetitions. This is normal. It means that the muscles are working intensely. If you find it easy to do 15 repetitions, increase to 20 or 25. If it's difficult, start with 10 repetitions and gradually increase the number as your muscles strengthen. Perform this exercise twice a day, in the morning and in the evening. In the morning, it gets the stagnant blood moving that has pooled overnight and prepares the legs for the day's load. In the evening, it helps to release the veins from the blood that has accumulated throughout the day. It is very important to hold on to a support, especially in the first few days, because you may lose your balance. As you train, your coordination will improve. Some of my patients, after a month of regular practice, can perform this exercise without any support, freely balancing on their toes. This indicates that the leg muscles have become much stronger. The third exercise is called the lymphatic drainage bicycle. It not only improves venous outflow, but also activates the lymphatic system of the legs, reducing swelling and inflammation. Lie on your back on a hard surface, on the floor, or on a firm bed. Place a small pillow under your head. Raise both legs up at an angle of about 45 degrees. Bend your knees and start making movements that mimic riding a bicycle. Pedal the imaginary bike smoothly and slowly. One leg extends forward and upward while the other bends towards your chest. Then the positions switch. Continue this movement for 3 minutes without stopping. During the exercise, pay attention to your breathing. Breathe deeply and rhythmically. Do not hold your breath. If you get tired, you can slow down a bit, but do not stop completely. 3 minutes of continuous movement are necessary to create a stable outflow of blood and lymph from the legs. This exercise is especially effective in the evening before bedtime. It reduces the swelling that has accumulated throughout the day, improves circulation, and you will fall asleep with light legs. In the morning, it is also beneficial. It awakens the entire vascular system and gives a boost of energy for the whole day. If you find it difficult to keep your legs elevated for 3 minutes straight, start with 1 minute. Gradually increase the time to 2 minutes, then to 3. If you have lower back issues and raising your legs causes discomfort in your back, place your hands under your buttocks with palms facing down. This will slightly lift your pelvis and relieve the pressure on your lower back. You can also perform the exercise with your legs resting against the wall. Lie perpendicular to the wall, lift your legs, and press your feet against the wall. Bend and straighten your legs, sliding your feet up and down the wall. The effect will be almost the same. Now, a very important point, how to properly incorporate these 3 exercises into your daily routine. In the morning, right after waking up, still lying in bed, perform the first exercise, the venous pump of the feet, for 20 repetitions. This will take you 3 to 4 minutes. Then get out of bed, wash your face, and after 10 to 15 minutes, when your body is fully awake, perform the second exercise, calf muscle pump, with 15 raises on your toes. This will take another 3 minutes. Have breakfast and attend to your tasks. In the evening, an hour before bedtime, perform all 3 exercises in a row. First, the foot venous pump 20 times, then the calf muscle pump 15 times, and then the lymphatic drainage bicycle for 3 minutes. The total time for the evening routine will be about 15 minutes. This is the minimum that will give you results. If you want to enhance the effect, you can perform the first and second exercises additionally in the middle of the day after lunch. This is especially beneficial if you sit or stand a lot during the day. Every 2 to 3 hours, take a short break, stand up, and do 10 raises on your toes. This will prevent blood stagnation and the accumulation of swelling. Even if you are sitting at a table and cannot stand up, perform the foot venous pump while sitting in a chair. No one will even notice that you are doing the exercise. Some of you might be thinking right now, my knees hurt, I can't stand on my toes. If you really have serious problems with your knees or hips, do the exercises in a modified version. For the second exercise, do it while sitting in a chair, lifting only your heels without raising your whole body. The effect will be weaker, but it will still be there. For the third exercise, you can do it with a smaller range of motion, not fully straightening your legs, but just slightly bending and straightening your knees. The main thing is regularity, not intensity. It's better to do the exercises every day in a light version than not to do them at all. Another objection is, I don't have time for this. My friends, we are talking about 15 minutes a day. You spend much more time watching TV or talking on the phone. This is about your health, about blood pressure control, about preventing strokes. 15 minutes a day is a very small price for normal pressure and healthy legs. Moreover, you can combine exercises with other activities. Do foot pumps while watching the morning news. Do calf raises while talking on the phone. There will be time if you really want results. The third objection is that I doubt such simple exercises can help. I understand your skepticism, especially if you've been taking pills for years with little effect. But try it for at least 3 days. Just 3 days do the exercises exactly as I described. By the third day, you will notice that the swelling is less by the evening, your legs feel lighter, and perhaps your blood pressure will decrease a bit. After a week, the effect will be even more noticeable. After a month, you will be surprised at how much better you feel. It's not magic, it's physiology. You are simply helping your veins do their job. How to understand that the exercises are working and the vessels are recovering. The first sign that will appear in 2 to 3 days is a reduction in evening swelling. Measure the circumference of your calf with a measuring tape in the morning and evening before starting the exercises. Write down the numbers. After 3 days, repeat the measurement. You will see that the difference between the morning and evening circumference has decreased by about half. This means that venous outflow has improved, and fluid is not accumulating in the legs as much as before. The second sign that will appear after a week is an increase in the distance you can walk without fatigue and pain in your legs. Remember how far you can walk now before feeling heaviness in your calves. It may be 200 meters or 500 meters. After a week, you will be able to walk 30% more without discomfort. This indicates that the muscle pump has strengthened and your legs have become more resilient. The third sign that you will notice after 10 days is an improvement in the mobility of the ankle joint. Try sitting in a chair now and pulling your toes towards you. How much can you bend your foot? Remember that feeling. After 10 days of regular exercises, you will be able to bend your foot significantly more because the muscles and ligaments will become more elastic, and the swelling that limited movement will go away. The fourth and most important sign is the stabilization of blood pressure. Keep a blood pressure diary. Measure your blood pressure in the morning after waking up and in the evening before going to bed every day. Write down the numbers. After 2 weeks, you will see that your blood pressure has become more stable and the fluctuations have decreased. After a month, the average blood pressure will drop by 10 to 15 millimeters of mercury. This is a significant improvement that reduces the risk of stroke and heart attack. Now, very important warnings. If you are taking blood-thinning medications such as warfarin, aspirin, clopidogrel, or new anticoagulants, start exercising cautiously. Strengthening venous outflow may temporarily change the effect of these medications. For the first week, perform exercises at half the dose, doing 10 repetitions instead of 20. Monitor your condition. If you notice unexplained bruising or an increase in gum bleeding, reduce the intensity of the exercises and consult a doctor. If you have uncontrolled diabetes with glucose levels above 12 millimoles per liter, be particularly cautious. Exercise improves circulation, which may change the body's need for insulin or blood sugar lowering pills. For the first 2 weeks, measure your blood sugar more frequently than usual, especially after exercising. If you notice a trend toward lower blood sugar, discuss with an endocrinologist the possibility of adjusting your medication dosage. If you have severe heart failure with shortness of breath at rest or with minimal exertion, do not start exercising without consulting a cardiologist.